I would like to acknowledge the Boonwurrung and Wurundjeri people of the Kulin Nations, both past and present, who are the traditional custodians of this land, and Aboriginal and Torres Strait Islander people present today.
Hi, my name is Sophie and this is Alyssa and Talia. Today we'll be discussing our newly established organisation. As a group, we've decided to focus on depression amongst elder Aboriginals in Melbourne's rural areas.
Together, we chose this topic because we believe it is a flourishing issue amongst the Aboriginal population. Statistic rates are much higher when compared to those in non-Indigenous communities. Whilst targeting the elderly, we recognise the misfortunes and traumas experienced due to colonisation, which disregarded traditions, cultures and customs. This image explores the tragic remnants of health issues in the Indigenous community as a result of migration. It exclaims that psychological health is the most prominent area of the detrimental conflicts, which have arose at 61%.
Amongst today's society, we have access to a variety of support services, such as Beyond Blue and Lifeline, where these programs aim to support individuals experiencing oppression and related stigmas. Therefore, within the Aboriginal communities established in Melbourne's rural areas, we find that the location is an ongoing issue, making it difficult for Aboriginal people to travel distances and seek appropriate healthcare support. Furthermore, we have found that Beyond Blue does not focus on Indigenous communities and does not aim to eliminate these target issues. Looking deeper, we have found that the Victorian Aboriginal Health Service Organisation is in fact an Aboriginal and Torres Strait Islander focused program, making it easier to target the specific issues of depression in elderly communities.
We will work alongside this program each fortnight, where workers from this initiative and of Aboriginal culture will attend elderly Aboriginals in their homes. This will ensure that they are receiving enough food consumption and are maintaining appropriate hygiene, whilst offering support networks with the aim to eliminate contributing factors of depression. This aids the individuals that cannot travel. We also cater to the people that can travel, where on the other fortnight weeks there will be a public event available for the elder Aboriginals, whereby they can seek help as a combined community. This then impacts holistic health, as it leaves people feeling accepted and welcomed within the society, whilst coming together with people of the same culture, thus being culturally acceptable and encouraging cultural awareness.
It is evident that by proposing our initiative with Aboriginal healthcare workers, Indigenous Australians will be confident in seeking and pursuing our implemented program. Engaging with workers of the same culture emphasises holistic health due to having shared experiences and emotions throughout their history, positively influencing Aboriginals' overall health and well-being. Depression amongst elder Aboriginals is factually higher due to the individuals experiencing the stolen generation crisis times. This created high distress and trauma, making it challenging to seek appropriate healthcare in order to fix arising mental health issues.
Our program will target elderly Aboriginals, people living in Melbourne's rural areas, experiencing mental health issues, specifically depression. This is reflected by individuals who are part of the stolen generations. We will work alongside the Victorian Aboriginal Health Services in order to eliminate the depression rates and closing the gap by creating fortnightly get-togethers of Aboriginal communities and workers.
Looking at this image, it tells us that overall in Australia's health system within the year 2016, Aboriginal individuals were not receiving a fair go at health. This graph explains that across the Aboriginal population who were living in a richer area, they were expected to live longer. This is a reflection that shows why our initiative is important for the Aboriginals living in a lower income suburb. They are said to not have as long of a life expectancy, specifically 4 years difference. Our initiative targets these individuals by implementing strategies in order to promote the closing of the gap between Aboriginal and non-Aboriginal patients.
As a group, we decided on the Victorian Aboriginal Health Service Organisation because it is an Indigenous run and focused program with access to the necessary resources. This allows for Aboriginals and Torres Strait Islanders to have their own support network from professionals of the same culture and understandings. Unfortunately, this foundation does not specifically target elder individuals, establishing a gap in the health system. By creating our own program, this will encourage the closing of the gap in an efficient and compassionate manner.
The 3 principles of engagement for the Victorian Aboriginal Health Service Organisation we believe consists of: the program will send Aboriginal workers that volunteer their time to check in with individuals that cannot travel to and from the organisation ensuring they have adequate living conditions whilst offering advice, support and help for those in need. The program is of Aboriginal culture and therefore encourages cultural awareness training to ensure that it is appropriate to all participants within the program. This program communicates mostly with the elderly, making this a respectful initiative for the community, encouraging effortless relationships within the workers and their patients.